It's time to imagine better health with CHI Health. For patients with uncontrolled epilepsy or brain tumor, surgeries can be life-changing.
Our guest is the only fellowship-trained epilepsy neurosurgeon in the state. He's also a world-renowned brain tumor surgeon, having worked in 8 countries. Dr.
Christopher Mascott is with CHI Health, here to explain who he's helping and how he's helping them. Good morning, doctor.
It's a real pleasure to meet you.
It is nice to meet you, yes.
Good morning. Thank you very much for having me.
Yeah, you bet. Okay, so spine and brain surgeries, they become this subspecialized kind of procedures. Which areas do you specialize in?
Well, most of medicine has become very subspecialized, and the idea of neurosurgery is a bit, out of date. In that everything is subspecialized or should be subspecialized. So I'm really an epilepsy and brain tumors super specialist and do mainly that. In a country where a lot of neurosurgery is actually spine surgery, and I do very little of that, if any. There's an advantage to being a super specialist because you really, there are training elements, there's technique, and things move pretty quickly. So there's an advantage to being a super specialist, and that is reflected in outcomes and procedures as well.
In helping people. Yeah.
Patients come to Omaha now to see you from all over because their health is the most important thing, and so they make that effort. But you've also worked around the world. I said 8 countries. Would you give us a few of them?
Well, I haven't been in Omaha that long, really. I was in Ireland for 10 years and had international referral there, and people from the U.S. and from England and elsewhere coming to Ireland. Before that, I was in France, and before that, I was actually in New Orleans. So quite a mix there.
You have an interesting story.
You do, and you've got this approach to brain surgery. It's not about the technical challenge for you. How do you view it?
Well, probably the important thing on the brain surgery side, at least what I would normally teach residents, is a lot of it is concept of what you're planning to do. And if you're dealing with something really difficult or really complicated, the more homework you do, the more pre-planning you do, the better. That's an illustration of a picture of a deep and dark place to go from a brain surgery side. The target is the green thing, which is actually a vascular malformation, in somebody who had epilepsy, who had seizures that wouldn't stop. And with current technology, most of it based on imaging, you can spend a lot of time doing virtual surgery and planning how to get to difficult areas. This is another patient, again with a deep dark lesion, again with epilepsy and seizures that wouldn't stop. But in order to try to safely remove things that normally people would term inoperable or at the very least difficult, you can get away with these things if you do them right. This is yet another patient, another deep area, again presenting with seizures that didn't stop. And this as a surgical thing from left to right was actually 2-stage surgery, and the patient for the first surgery needed to be awake to test where speech function was in order not to mess up speech.
That's an aspect that I find very fascinating.
How common is epilepsy, and at what point does surgery become the best course?
Epilepsy is the second most common chronic neurological disorder after migraines. It's actually, in most countries, 1% of the population would be a reasonable estimate. So it's very common, and about 2/3 are well controlled on medication. 1/3 aren't well controlled on medication and worth further investigation, and surgery may be an option if you can find something localized that is causing the seizures. It's very elaborate, it's very multidisciplinary. It requires a team of neurologists, neuropsychologists, and looking for what to do is quite involved in that you need to look at brainwave activity, where are the seizures coming from, looking at fancy MRIs and fancy scans to show where the activity is coming from. So it's quite involved to actually find the right thing to do for the right person.
Yeah, and I want to mention, because you brought up multidisciplinary team, this team that you work with, incredibly talented, different aspects of medicine, but how does that impact patients, whether it's epilepsy or whether you're dealing with a brain tumor?
Well, I think, you know, contemporary state-of-the-art medicine is going to be multidisciplinary across the board. The same thing for brain tumors. Brain tumors, if they're slow growing, it might be primarily surgery, but if they're faster growing, you might need forms of radiation, you might need chemotherapy. I'm actually quite involved in radiation as well, and on the brain tumor side, very often for tumors, especially that have come from elsewhere or that are down at the skull base, you can do computer-focused radiation called radiosurgery, which has been around since the 1960s. But in some cases, this is the equivalent of surgery. So you can have outpatient treatment that will treat tumors, usually not tumors that start in the brain, but other tumors that come from elsewhere. This is an illustration of breast cancer with two fairly large tumors on the top, and 2 months later you can see the shrinkage, and that was done as an outpatient procedure of basically just computer-guided radiation, and no surgery at all for that. Works for other things as well. This is a large vascular malformation, so not a tumor at all. But the green part is the target called the nest or the nidus. That's actually a quite large one. And treatment, again, with computer-guided radiation, radiosurgery, led to this disappearing over a 3-year period. But it can, for this, it can take that long.
You are changing lives here now, right? You've done it around the world. I read one patient's review who said it was a loss to their country when you moved away. That's how highly she thought of you and what you'd done for her father. So Dr. Mascott now with CHI Health, and here's some information. He asked that we put his cell phone number on the screen because he provides that to all of his patients. And again, that speaks to care. Do you have questions? Do you have concerns? He's available. And we said, are you sure you want to do this? We don't know who's calling.
It's very brave.
But really, that's what it's about, is changing lives online. It's chihealth.com. Doctor, thank you.
And our camera's got a shot of the model. We didn't get to it, but next time you come on,
we could have talked forever to you,
very
honestly.
fascinating.
Thank you for coming.
Mary, Mike, thank you very much.
We appreciate it.